everybody. We're here to answer some stuttering questions as they relate to counseling children and adults who stutter. So the first question is, what do you feel like is the best approach for counseling a young child who stutters?
Well, if we're talking about a preschool child, I think probably the best approach is to counsel the parents of the child first and make sure that they have the knowledge and background in stuttering and know how to react to it and not get really upset or nervous by it and just respond to it in a matter-of-fact manner. I think the best thing you can do for a young child who stutters is just to tell them it's okay to have bumpy speech and you still want to hear what you have to say, particularly if a child is having negative reactions to it. I think you can also just do some things from a counseling perspective to play around with stuttering and working on desensitization a little bit by just having them do some purposeful stuttering with you back and forth.
There's been some kind of fun activities that other clinicians have used, who can stutter the loudest, who can stutter the longest, making stuttering out of Play-Doh, making a drawing of stuttering. So all of those are desensitization activities where it's really bringing the topic of stuttering to the forefront and not letting stuttering be a taboo topic. And I think that's really underscores successful stuttering therapy is not being afraid to talk about stuttering, not being afraid to use the S word or bumpy speech or whatever you call it. And typically what I do is I'll ask the child, what do you want to call stuttering? Do you want to use the word stuttering, or do you want to call it something else? Do you want to call it bumpy speech, or what term do you want? That gives them a little bit of ownership of their speech, and as we were mentioning in an earlier segment, to demystify what the experience or nature of stuttering is. So if you're counseling a child or an adult who stutters and they become really emotional about their stuttering, they become overwhelmed, maybe start crying, they put here uncontrollably, what do we do? How do we handle that?
Well, I think first of all I would see that as maybe a positive if they are being emotional about it, because it might mean that they're finally dealing with it, and that means that they're finally accepting the fact that they have it, and it's kind of hitting home for them. So I think allowing those feelings and emotions is really important. I think if it becomes unproductive, then I think you have to look at a couple different pathways. Number one, if it's really unproductive to the point where it's not even just about speech, but starts to involve other areas, you might need to refer to a psychologist. I think that if it's all about speech, but the child's really reacting strongly to it, you might have to do some probing to see if there's other experiences that the child may be having that they're not really willing to talk about yet.
Yeah, and I think, Craig is right. We really have to think about what's within our scope of practice. We are certainly able to counsel a person when it deals with the communication disorder. Whenever an issue goes beyond the scope of communication disorders, that's when a referral is indicated. Sometimes that might mean collaborating with a psychologist or counselor and educating them about stuttering, because a lot of times that misconception still exists among other helping professionals that stuttering is something that's caused by a psychological issue. So we need to educate those professionals, whomever the person is working with, to make sure that they are clear that stuttering is can be genetic or neurophysiological in nature, and address the other psychological concerns appropriately. Okay, what is one of the hardest situations you've dealt with in which counseling was a main part of therapy?
You could probably talk about a lot of different situations here. There's two that just jump out to me that they're very memorable. One is I had a girl one time who she used to leave Post-it notes on her desk, and she would, if she felt like she was having a more disfluent day, she would put a Post-it note on her desk to tell the teacher not to call on her that day. And so, when we started therapy with her, I told her that our goal was, by the end of therapy, she would not only not be putting those Post-it notes up, but she would be actually volunteering to participate. So, we had to handle that in a more systematic kind of way, where my first goal with her was just to not get her to put the Post-it notes up. It wasn't to participate. And then eventually, as we moved through therapy, she did get to a point where she would raise her hand and volunteer 1 time a day, and then it became 2 or 3 times a day. And by the end of therapy, she was participating just like anybody else in the class. I think the other one I can think of off the top of my head is I saw a kid who was maybe 10 or 11, and his stuttering had impacted him to the point where he didn't want to leave the house. So he went from being in school to being homeschooled, because he didn't want to go anywhere or participate in anything. And again, the first time I saw him, I said, my goal for you is to be back in school next year. And we've slowly worked toward that, where his first step was to just leave the house. And then he started to go out and in restaurants and things like that and talk and stutter on purpose. And then eventually we worked up to him being back in school the next year.
So Craig talked a lot about kind of scaffolding those goals a little bit, and I think that's something really important to keep in mind for our clients in thinking about what they're ready to do. If we push them for something they're not ready for, that can be more detrimental, right? So we have to think in incremental steps to reach that end goal. You don't come into your first treatment session on a Monday and then require the child to start raising their hand in class that Tuesday. Again, setting our expectations in line with reality and thinking about all of those small steps in between. And a large part of that is having the child or the adult come in and just talk openly about their stuttering. It's amazing that when they start talking, that they start to make a lot of realizations about themselves, which can lead to a greater self-awareness, self-efficacy, and so on. And, just having a space where they can come talk openly about stuttering, where we can help to be their advocates, and importantly, to hold them accountable. We can set goals all day long, but if we're not the cheerleader on the sidelines and their advocate and checking in to make sure that we're supporting them and they're supporting themselves moving forward, they're not going to make any progress. So we truly have to hold our clients accountable by checking in to see how it's going, seeing their participation in class, asking the teacher. So it really becomes a community. Really, therapy is not just with the child, but it's so much larger than that. So we have to think of all of the communication partners that are involved along the way and that are important to that child. Can you provide an example of how to tell a parent or child that they will always stutter?
This is a conversation that's always very difficult to have. It doesn't ever get easier. It's a very emotional conversation to have with a child and with a parent. And I also feel, on the other hand, that it's one that it's really necessary to have very early on in the process, probably at the diagnostic. And, really what I try to do in those situations is I start by asking the child what their goals would be for therapy. And almost 100% of the time, the child says, "Stop stuttering," which is, a reasonable thing for a kid to say. And so I use that opportunity as a way to talk about how that's probably not a realistic goal for their age for a person who stutters. And so if a child says that to me, I'll say, one of the things we know about stuttering is that if you hit the age of 7 or 8 or older and you're still stuttering, the chances of it ever going away completely go down pretty significantly. So what we have to focus on is not so much about trying to eliminate it or cure it, but we have to focus on being able to manage it. So while we can't focus on just not stuttering anymore, what we can work on in therapy is to help teach you about it so you become the expert in it. So when people ask you about stuttering, you know how to answer the questions. We can work on helping you stutter less. We can work on helping you so that talking isn't as hard or isn't as much work and you don't feel as much tension and struggle to get through it. We can also help make stuttering not have a negative impact on your life, where you don't think negatively about it and you don't let it interfere with your ability to participate in things. Most of the time when you lay out that scenario for kids and parents, that's ultimately really what they want. It's not so much about being completely fluent all the time. They just want a normal life. And I think hearing that for most people sets them on the path of, okay, this isn't something that's going to go away, but this is something we can make a lot of improvement in and a lot of progress in. You do have those people every once in a while where they just don't hear you, and it's like, no, I just want to eliminate it. And you got to be really honest, with those people, and I will basically tell people, I'm not really sure that I can give you what you need if that's the case, because I don't think I can make people who are 9, 10 years old and older not stutter again.
Mm-hmm. Yeah, and I think we can't be afraid of emotion during those conversations. One of the best tools that you can have during an evaluation is a box of tissues, because it's the first time for a lot of parents and a lot of children that they're hearing that they're going to stutter long term. We've seen numerous children over the years who come to us as school-age children, and they've never heard that stuttering is something that tends to be lifelong. So we're often on the front lines of having those really tough conversations with the children. And you think, okay, well, if somebody had had that conversation with that child, 5, 10 years earlier, we would be on a much better track in terms of helping the child to manage their stuttering from an emotional standpoint. And so there's this one quote that I really like. When we avoid having hard conversations with people, we trade short-term discomfort for long-term dysfunction. And those conversations are hard, as Craig said, but we're really doing the child or client and their families a disservice when we're not being completely transparent about the nature of stuttering. Okay, thanks everyone.